Good morning, everyone. Welcome to the Ohio Rare Disease Day event. We'll begin in just a minute. Hey, good morning, everyone. Welcome to the Ohio Rare Disease Day event. We're going to go ahead and kick off our event this morning with 2 short videos, and then we will rejoin as a group. So bear with me one moment as I get those videos started.
I am Tristan.
Angelina.
Nama saya Syafiq.
Regina.
Habari asubuhi, Javi.
Jeg er Christian og jeg bor I Norge.
I live in the United States of America.
In Australia.
Malaysia.
No Brasil.
Tunaishi Kenya.
My passion is for fashion and design.
I love to dance.
Menyusul
Para viajar e descobrir novas culturas.
Anapenda kunitazama nikipuliza mapovu.
Jeg elsker idrett og spiller spill med familien min.
Minhas paixões são minha fuga quando as coisas estão difíceis.
Ada hari-harinya apabila melakukan perkara yang biasa akan jadi sangat susah.
When your disease makes you feel isolated.
It's difficult to walk. Å være med på laget.
When I'm tired.
Afraid.
O controle da doença pode ser desafiador.
Atau mengecewakan bila saya kehilangan masa.
Muda muhimu sana.
But we learned to be resilient.
Para apreciar os pequenos detalhes que me trazem alegria.
Kumuona mtoto wangu wa kiume anavyofurahi tunapoenda nje. Nikijua anasikiza hadithi na sauti zilizo karibu.
Mencari titik hubungan dengan masyarakat yang tak pernah saya sedar wujud.
Å være uavhengig på grunn av menneskene rundt meg.
Their fierce support.
Sua bondade inabalável.
The big love. Mine venner.
Keluarga.
Enfermeiras.
Doctors.
Support workers.
Assistenter.
Mashirika ya wagonjwa.
Together, we are a strong community.
Nimeweza kuelekewa.
Histórias compartilhadas que me libertaram das dúvidas.
Og ga meg selvtillit.
I am Tristan. I live with sickle cell.
I'm Angelina.
And she has CASC, a neurological disorder. Saya Syafiq dan saya hidup dengan ectodermal dysplasia.
Regina, eu tinha leiomiosarcoma, câncer raro.
Huyu ni Harvey, ana SMA, spinal muscular atrophy.
Jon Christian og jeg har UI, medfødt benskjørhet.
Esta é minha vida.
Suara saya.
And I am more than my disease.
We are rare.
Kami ramai.
Nós somos fortes.
And we are proud.
All right, and we have one more video to share with you for our welcome.
Welcome.
Hello, this is Tim
I'm
Ginder.
President and CEO of the National Organization for Rare Disorders, and would like to welcome you to our 2021 Virtual Rare Disease Day event. But before we begin, I'd like to send out a special thank you to all those advocates and others who've spent so much energy and time supporting the rare disease community. So thank you. The role of Rare Disease Day is to bring together advocates and patients from around the world to help tell the story about rare diseases. There are events like this happening virtually all over this country today. And some of the audiences that we're really trying to focus on are those in the state legislatures, where advocates and legislative people come together to understand the burden of rare diseases and the impacts it can have on them, and therefore build the appropriate legislation and pathway to make sure that bills are passed that support rare disease patients. As a matter of fact, NORD's doing that in a very focused way with rare disease advisory councils. We've got them set up down in 16 states and are building them in others. I think 2021 is going to be an interesting year for us. The reason I say that is because we've just come off of a very difficult year with a pandemic that's impacted the rare disease community in a number of different ways and has really shown some of the inequities in the healthcare system. For all of you that are watching today, the importance of the rare disease advisory councils is critical to the success of being able to communicate the story and the needs of the rare disease patient community. So in conclusion, I would really like to make sure that I recognize and thank all of those sponsors who have helped us make this day a reality. Without your continued support, none of this would happen. So a sincere thank you from all of us at NORD and the patient community. Taking part in events like today's are really important to the rare disease community. And we must always remember that alone we are rare and together we are strong.
All right, thank you everyone. And with that, we'll go ahead and kick off our presentation. I'm going to turn it over to our fantastic volunteer leadership team from Ohio.
Hi, good morning, everyone. My name is Charlene York, and I'm the Ohio State Rare Disease Volunteer Ambassador here in Ohio. And I just want to go over a few things here. We are here for Rare Disease Day, but we are not here to give any medical or legal advice. NORD does not do that, and we encourage you to seek legal advice or medical advice from other sources. We're here to support you, but we will not be doing any of that today. So that being said, I am so excited that you are here today. This is such a unique situation that we're in. But what's so wonderful is that this is the most attendees that we've ever had registered for this day. So again, this is an exciting event. And what we will be focusing on this first hour is the Rare Disease Advisory Council here in Ohio. We are going to start off with the Ohio State Report Card. And one of the things that we are graded for is for having a Rare Disease Advisory Council. And then we'll roll into a very brief overview of the Ohio Rare Disease Advisory Council, where we are in a unique situation where we just had legislation passed and signed by Governor DeWine. So we're sort of in between where we've got legislation passed, but now we need to establish our council. And then we are going to have lawmaker remarks from Representative Tim Ginter, who was one of our representatives, co-sponsors of the bill. And then also Senator Kuntz, who also helped us champion the bill through the Senate. We will have patient caregiver stories and why it was important to have this council established. And then we'll also hear from a healthcare provider and a patient organization. And then we will have a Zoom activity for you guys to participate. And then finally, there'll be closing remarks. And then at 11 o'clock, we will have 3 breakout sessions. Some of you have, when you registered, you had the opportunity to pick from 3 of these sessions. If you have not picked any of these, you are welcome to join that. You did not need to pre-register for those sessions. So that being said, I will turn it over to Tiffany. In addition to me being an ambassador, I also have a co-ambassador, Tiffany Salmons, and then I also have a community engagement liaison who is Sarah Sharp. So at this point, I will be turning it over to Tiffany. Can't hear you.
Let's try this again. Hi, everyone. Like Charlene said, my name is Tiffany Salmons, and I just recently became her co-ambassador from the Community Engagement Liaison role. And I'm very excited that you are all here today. I'm going to just give a brief overview of what the RDAC is, and everybody else will kind of expand on that today and tell you why they think it's important. So we've established our Rare Disease Advisory Council here recently, and it will be appointed April 23rd. So there's still time if anybody is interested in applying for those positions. But what the bill does is it's going to bring together medical researchers, physicians, nurses, individuals living with rare diseases, as well as lawmakers and policy officials to begin addressing many of these issues that Ohioans living with rare diseases are facing today. It's also going to pave the way to just providing expertise that lawmakers need to solve all of these issues that many times they're just unaware of. We are rare, so it's not like they hear of them every day. So to have this council established is going to help with that. So that's kind of an overview on it. And I am going to turn it over to Sarah, who is going to talk about the state report card.
Morning. I'm Sarah Sharp, and I am the Community Engagement Liaison for the Ohio team. And I do believe that our friend Alice from NORD is going to talk more about the report card in different areas that it looks at. I wanted to share with you some of the accomplishments of the Ohio team thus far, heading into our the development of our RDAC. So prior to the Rare Disease Advisory Committee's bill passing, some things that we worked on, Charlene really built out the team, and that included bringing Tiffany and I on, and also we're always looking for more volunteers and partners. Like some of the people that you'll be hearing from today, or the Connor B. Judge Foundation. They're a great partner for us. And we've also worked towards improving legislation in the areas that they're going to talk about, including step therapy, or removing insurance barriers to patients getting the medications that they need, as well as establishing the Rare Disease Advisory Council.
Wonderful. Thank you, Sarah. And good morning, everyone. My name is Elise Patel, and I'm the Western Region State Policy Manager for NORD. And so today we wanted to talk to you, as mentioned, a little bit about our report card. So this is our 6th year of publishing a state report card. And the report card is really a tool to evaluate how effectively states are serving the rare disease community, a way to track individual state progress on our priority policy issues, as seen on this slide, and enable effective advocacy by providing that tangible tool to see how your state measures up in key areas. So the issues outlined touch on several critical and relevant policy issues. However, we understand that there are still other policy areas that impact the lives of rare disease patients. And this year, we transitioned the report into a new interactive digital format. So there's a state report card landing page, as well as a web page for each of the 8 issues that are highlighted in the report. So feel free to use the link provided on the slide to see how Ohio measures up. And then I want to share a little bit of methodology on the state report card. So all of the data that you'll see on the report is data as of November 2020, with the exception of rare disease advisory councils. We updated the RDACs through December to reflect the exciting passage of RDACs in this great state of Ohio, as well as Massachusetts at the end of the year. And any current bills in the state legislature currently that have that are being worked on, or that have already even passed at the beginning of 2021 were not factored in the report card grade. And each issue you'll see has its own appendix that we derive the overall grade from. And then each individual issue page also contains a grading methodology section where you can read more about how the issue was evaluated. And if you have any questions about our report card or our Project RDAC, you're always welcome to reach out to us at policy@rarediseases.org. We're always happy to answer any questions. So now I want to talk to you a little bit more about why RDAC started in the first place and where we're headed this year as an organization. As many of you know, 25 to 30 million Americans are impacted by a rare disease, which breaks down to about 1 in 10 individuals. And while that's quite a few people directly impacted, what we're finding is many lawmakers aren't necessarily aware of the unique challenges that are faced by the rare disease community. So our solution was to form rare disease advisory councils, where a diverse group of those in the rare disease community could come together and advise state government. And this is especially important because we know that many of our healthcare decisions are actually made at the state level. We also see this as an enormous opportunity for the community and legislators to come together and partner in a more strategic way to really address the issues that we're seeing on a regular basis. The first council was created in 2015 by some wonderful advocates in North Carolina, and since then has gained quite a bit of traction across the country. And as you can see from this slide, there's currently 16 states that have passed RDAC legislation, with Massachusetts being the last state to do so just a couple months ago. And you'll see much of this progress has actually happened over the course of the last 2 years, with 10 governors signing RDAC legislation into law since 2019. NORD launched Project RDAC this past year as a way to help optimize the existing RDACs and also as a way to increase the number of RDACs across the country. And under this initiative, NORD will be providing opportunities for RDACs to collaborate with each other, as well as providing educational resources to guide RDACs for every step of that journey. And feel free to visit our website, rarediseases.org, and click on the Project RDAC tab. There you'll find resources, upcoming events, and an interactive state map where you can view Ohio-specific information. And as you guys have heard, we're really excited that House Bill 412 was passed in December of 2020, and appointments to the council are already underway and expected to be finished in April. And as Tiffany had mentioned, the bill will really enable the council to coordinate those statewide efforts for studying the incidence of rare disease in Ohio, and also promote that collaboration among rare disease organizations, clinicians, academic research institutions, and the General Assembly. And while this is a brief overview, you're going to definitely hear more about the Ohio RDAC later in this presentation. And so with that, I'm going to go ahead and turn it back over to Tiffany.
Hi everyone, so some of the tasks of the RDAC, the bill will require the Advisory Council to prepare and submit a report to the General Assembly prior to the expiration of each term, and the report must include the details of the following. So the coordination of statewide efforts for studying the incidence of rare diseases, the Advisory Council's findings and recommendations regarding rare diseases, research and care, and efforts to promote collaboration among rare disease organizations, clinicians, academic research institutions, and the General Assembly to better understand the incidence of rare diseases. And our bill sponsors were Tim Ginter, Stephanie Kuntz, and Randy Kleitz, who are on this call, and you will hear more from later in the presentation. So who is eligible to be on the board? Patients, members of patient organizations, researchers, clinicians, industry, government officials. And the deadline, like mentioned earlier, is April 22nd. And here is the link if you would like information to reach out to her, and she can send you all of the application information. So now I'm going to turn it over to Elizabeth Stapleton, and she is going to give her patient story.
Yeah, I want to interrupt here for a second. I am waiting to hear from Representative Ginter and Senator Kuntz. They're very busy, so we, at some point, Elizabeth, I'm going to let you go ahead and give your presentation, but should these two people come in, we're going to have to interrupt your presentation, Elizabeth. So that being said, I'm just going to briefly introduce Elizabeth. She is, oh, who do we have on the phone here right now?
Hello, this is Tim Ginter. This is Representative Ginter.
Beautiful. We just your timing was impeccable here. I'm proud to introduce Representative Ginter. He was one of our co-sponsors for our House Bill 412. He is on his way down, down to Columbus. And I will turn it over to you. Thank you so much for co-sponsoring this bill. It was a great success story for us, but I will let you have your say here, Representative Ginter. Thank you.
Well, thank you, and good morning, everyone. I hope you can hear me. I am traveling south on 71 right now towards Columbus, so hopefully you can hear me over the wind noise in my car. But I was very honored to be asked by former Representative Kleitz, who just was a tremendous asset and someone who really helped to carry the weight of this bill, and I can't say enough about her. And to joint sponsor House Bill 412, which, as you already know, was to establish the Rare Disease Council in the state of Ohio. And we're so glad and proud that it was signed by the governor in December and is soon to go into effect. I know that I'm sure that you've already heard much about this bill and what it puts in place, but I was thinking about this, and let me interrupt myself by thanking Senator Kuntz for championing this bill over in the other chamber. Without an advocate over there in the opposite chamber, a bill can die, and so we're just very grateful to her, I want to say as well. But as a legislator, first of all, I actually learned so much about rare disease through the process, and I was so honored to, like I said, to carry it, and worked with just great interested parties and stakeholders such as NORD and cystic fibrosis and Ohio Bleeding Disorders and Akron Children's Hospital, Nationwide Children's Hospital, and so many more that could be named. But I see it as a tool for the rare disease community. And I was thinking a little bit earlier as to, what it accomplishes. And I guess I would liken it to something that's perhaps easier for me to remember. And I believe that it is placed into the hands of the rare disease community in the state of Ohio and increasingly across the nation, several key areas of several key points that will serve to forward the cause of those whose families who are involved in the rare disease efforts and those who are affected by it. And so I see it as representation in that they have now a voice and can advise the General Assembly through their reports, through advocacy. So I see it as representation. I see the Rare Disease Council as coordination, the coordination of statewide efforts in regards to studying, for example, the incidence of rare disease. I see it as a form or a means of communication in that they can share with one another the findings and recommendations regarding rare disease, and a way for them to, I know they communicate, I know you all communicate with one another, but this gives you an official platform of communication, and then finally collaboration, an effort to, in those efforts to promote collaboration among rare disease organizations. I see this again as a tool to increase the effectiveness and the influence of the rare disease community. So, having said that, I will not linger any longer, but I'm very excited. I was very honored again to be joint sponsor of this wonderful legislation, and I'm excited to see what happens as the work of the Rare Disease Council moves forward. So thank you much. Thank you for all the work that you do, everybody on this call and on this Zoom meeting.
Thank you again, Representative Ginter, and safe travels down on the way down. I'm just going to wait a minute here for Senator Coons to come in. Hopefully she can join us. This was a wonderful opportunity for both sides of the aisle to work on something that it affects everybody across the board. And on both sides, no matter where you stand. And I think it's a wonderful opportunity. A rare disease affects everybody, could affect everybody out there. I was very happy that both Representative Kleitz and Ginter were able to work on that. And this again is something that NORD had been wanting us to do. There we are. Let us admit. Senator Coons, are you with us today? I am waiting. Are you here?
I am. I apologize. I couldn't get the code to work. Good morning.
That's okay. That's okay. That's okay. Perfect timing. Representative Ginter just got off the phone with us, and I am so happy that you are here to join us. You really helped us champion that bill through the Senate, and if you could comment on how important this was to you and to your constituents and to all of Ohio here.
Absolutely. Thank you so much for having me this morning. House Bill 412 was very important to get passed, I believe, last General Assembly. And I want to give a big shout out to my friend, Randy Kleitz, who worked tirelessly, especially on that bill, along with Representative Ginter, to make sure that families in Ohio and individuals in Ohio that face a rare disease really have representation at the table here at the state level while we make decisions on how to not only advocate for funding for families, but also research and other, we know that medicine and technology are moving quickly, and we wanna make sure that we're adapting quickly. Government doesn't normally adapt quickly to a lot of things, unfortunately, but I think having the 25-member council here at the state level, representative of families and those who are living with and facing rare disease will be just another important voice for us to understand what's needed, what's necessary, how can the state partner with you to ensure that we are doing all that we can to boost the quality of life and also extend life to people with rare diseases. I've been blessed as the state senator from the 16th Senate District right here in Franklin County by our excellent medical facilities and hospital systems. And I actually represent quite a few families that have a child with rare disease and have been really blessed to get to know them, to hear their stories, to understand their struggle as it relates to insurance and Medicaid. And I'm just very hopeful that through their advocacy, folks like Kelly Maynard at Little Hercules and Foundation, that some of the work that the council will do will really help to alleviate the additional stress and burdens that families face when they're trying to cover treatments, or maybe it's something new in a gene therapy technology, or just access healthcare here in our state.
Thank you so much. We were just thrilled to have that done, and as I was saying to Representative Ginter before you came in, this was a perfect opportunity where both parties were able to work on this and come to an agreement, because again, rare diseases can affect anybody at some point, across the board, no matter what. So again, this is something, piece of legislation that we worked on, and there's other pieces of legislation that the Ohio Rare Action Network has worked on and will be continuing to work on to advocate for those with rare diseases. But again, thank you so much, Senator Kuntz. I know you're busy, and I thank you for your time. Thank you so much. You're welcome to stay with us, but I know you're busy. So
I have committee at 10:30, or I would, but I just want to say thank you. Thank you to all of you for the advocacy and the voice that you bring for families. We're grateful. Have a great day.
Thank you. Thank you so much.
Bye-bye.
That being said, I am going to turn it over to, we have two patients. Nord has always listened to those that are affected with rare diseases, listen to their voices. And again, the Rare Disease Advisory Council is one of the tasks that we here in the state of Ohio would like to see established. So that being said, I'm going to turn it over to Elizabeth. I've known Elizabeth for a couple years, and she is going to comment on why it is important that we have established this council. So that being said, Elizabeth, I'm going to turn it over to you.
Hi, I have a prepared statement. In 2016, I first experienced symptoms of hyperexplexia. I had what I thought were seizures, but I was fully conscious throughout the progression of an increasing frequency of symptoms. I was misdiagnosed, and it took 9 months for me to get a proper diagnosis. There was one doctor, now retired, who recognized my symptoms, and today I have to educate my neurologist about my own condition. In 2017, I first began having severe respiratory infections despite aggressive treatment of my asthma. I realized that something was probably wrong with my immune system. 2 years later, I was diagnosed with common variable immune deficiency. I now get monthly infusions of gamma globulin, and this will be a lifetime treatment. In 2019, I also got genetic screening for Alport syndrome, a disease of progressive kidney failure, hearing loss, and eye differences. I tested positive. I inherited the gene from my father, who recently had a kidney transplant last year. The Rare Disease Advisory Council is important to me because it gives me hope that its members will help inform Ohio's healthcare system of rare diseases and their prevalence in Ohio. For example, there are only 3 known hyperexplexia patients in Ohio. I am one of them. Also, I hope that the RDAC can collect and produce a statistical picture of Ohio's rare disease community. Currently, I am collecting some of this information in a database of rare disease organizations, chapters, and contacts in Ohio. So far, I have about 500 entries, but I'm only at M, as in Mike. If you can help me, please feel free to contact me at Bandimal, that's B-A-N as in Norman, D-I-M as in Mike, A-L, at yahoo.com. Finally, I hope that the RDAC will inform the state's officials of the needs of the rare disease community. Many of us deal with complex issues involving insurance and or are disabled and on Medicare and Medicaid. As Medicaid is a state-run program, it is important that our legislators and the Ohio Department of Insurance are aware of the rare disease community. The RDAC can do all of this and more. Thank you for listening to my story. In the meantime, I want to thank the National Organization for Rare Disorders, Charlene York, Tiffany Salmons, and Sarah Sharp for their support and work in organizing today's event.
Thank you, Elizabeth. I am putting your email in the chat box. So if anybody would like to assist Elizabeth, that is a lot of organizations in Ohio that have chapters or societies or whatever, and you're just at the letter M, which is great, you know, that many. So I put Elizabeth's email in the chat box, and right now I'm going to turn it over to Demi Montgomery. I just recently met her in the last year. One of the things we did throughout the year, because of the pandemic, we had virtual events, monthly virtual events, and I met Demi like literally in our backyard. She's in Dayton and I'm in Oxford, and she will talk about, again, how it was important to have this council established. So Demi, I'm going to turn it over to you, and welcome, Demi.
Good morning, everybody. I was going to prepare something, but I decided to just speak to you guys straight from the heart. I really appreciate that somebody took the time and that NORDS took the time to create this council. It was much needed for many years. I have scleroderma, and I was diagnosed in 2001. I was only 19 years old, and I was really scared. And there was nothing out there to really tell you about what scleroderma was and what it did to the body. So there was not much information. And then I was misdiagnosed. I was told I had morphia first. And then I went to a specialist, and the specialist said, hey, you have scleroderma. Get ready. It's going to be a long journey. So 20 years later, because it's 20 years later, I have had 4 amputations of the fingers. I have had 1 amputation of the toe, many debridements, many surgeries, and there's still not much known about scleroderma. When it came to trying to get awareness about scleroderma, I worked with the Scleroderma Foundation, and we were able to get Bill 133 passed in 2006, declaring Scleroderma Awareness Month for June, and we still wanted to do more. So that's what made me go to NORDS, is because they were working on a bigger effort to get more knowledge out there for the doctors and for the public officials to recognize what is going on with these rare diseases. We need help, and we need assistance, and we need a voice. And without that voice, we are sitting and suffering in silence, and that is a problem. And so I feel that this advisory council will do so many things for so many people that it is just beyond the scope of what I could have ever imagined. So I am so grateful that NORDS has took these efforts and that this is being done, and we'll have a voice now, where we suffered so long without that voice, and this voice was so much needed. So I want to thank all of you guys at NORDS for everything you guys are doing, all the efforts being made. And I look forward to participating in everything and being a part of this journey with you. That was it, Charlene.
Yeah, I got it. Thank you so much, Demi. You just mentioned what you do with your organization very briefly. What you do, I know, you know, you run a discussion group here in Ohio with your rare disease?
Yeah, well, what we do is I'm part of the advocacy committee, and we go to Hill Days. I've been to Capitol Hill 3 times to speak with legislators about scleroderma and what it does to the body. And then we also obtain proclamations yearly From the governor's office, we do it statewide, then we do it locally too, at our local levels, to just bring awareness to scleroderma. And now we have started a 50-state effort to get proclamations in all 50 states declaring Scleroderma Awareness Month. We are headed towards doing as much as possible in the state of Ohio. Lucille Miller is our president, and she is phenomenal with getting the information out about scleroderma and what it does to the body. So we participate in a lot of different things. I'm also on the board for the state chapter for Scleroderma Awareness, or Scleroderma Foundation.
Yeah, thank you. And, you know, we as NORD and the Ohio Rare Action Network, we were one of other organizations here in Ohio that advocated for the passage of the Rare Disease Advisory Council. So Demi's organization signed on to it. The Connor B. Judge Foundation signed on to it. The American Cancer Society signed on to it. The Ohio Academy of Pediatrics signed on to it. So there were other organizations. It wasn't just us. We worked with other organizations in Ohio seeking testimony, seeking their support for this Rare Disease Advisory Council. So again, this was a group effort behind the scenes, grassroots, to submit testimony orally and written at the time when these bills went through the committees, both in the House and in the Senate. So at this point, you know, part of the council makeup is to have a representative from a clinician or a researcher or a geneticist out there, and then also a representative from the patient, a patient organization here in Ohio. And Dr. Pina, are you on with us today?
I am.
Oh, how wonderful. I'm just going to segue a little bit. The majority of rare diseases are diagnosed at the genetic level. And doing that genetic testing has, you know, in the last, 10, 20, 15 years, has really opened up, you know, diagnosis for those with a rare disease. So I cannot say enough how it was important in our family to get a genetic diagnosis. It really solved a lot of issues for us. And so I cannot thank you enough for joining with us. She's at the University of Cincinnati. Are you with the Children's Hospital there?
Yes, I'm one of the geneticists at Cincinnati Children's. Yes.
Yes. And I'm going to let you talk about how it's important to have this council here in Ohio being established. And again, thank you for your time. I know you are very busy.
Yeah, it's my pleasure to be here today, and thank you for inviting me. I have been a geneticist for about 11 years at this point, and what I can say is that we have really seen a revolution in terms of diagnostics for rare disease. And what I have come to appreciate is that the diagnostic piece has advanced quite a bit. Insurance does stand in the way and is a big hurdle for getting the testing that we need in order to diagnose our patients. And a diagnosis is really the first step in the journey towards healing for a family, because we can provide not only a name, but also information about the disorder. We can share the management information that's on the published literature for families. And very importantly, this also opens the door for getting together, for a family to join a family group. And in that way, there's also been a revolution in terms of families coalescing around a new diagnosis. And social media has been just huge in allowing families to get together for the sake of the children and for their own sake as well, if we're talking about adults. And for us as clinicians that it's also hugely helpful because it's a source of knowledge that allows us to care for the patients, because there's a lot of unpublished knowledge that families have regarding the affected individuals that is not in the published literature, and it's all only accessible to us through the families. And so genetics has changed quite a bit in the last decade. And I think that leads then to organizing at a higher level. And so NORD is huge in helping us and helping families get organized around a disorder. And at the state level, I think having this Rare Disease Advisory Council only facilitates that role of NORD and of family organizations by improving awareness and really holding states accountable in serving its entire population, which includes the rare disease population. So I'm really pleased to hear that this is now a law, and it's only the beginning in helping all of us partner in serving our families, really. So I'm very grateful for all of you to having me speak here, and I look forward to working with the group as we implement this new legislation.
Thank you so much. One of the things that I see coming down the road, and since you're on the phone with us, Doctor, is gene therapy. That is going to be one of the major tasks that we in the rare disease community will have to educate legislators and government officials on that. And we've seen the struggle that SMA had, and there are other gene therapies out there, and also other that are being developed. And there's going to be, I'm sure, pushback from the insurance companies and others on gene therapy. And that is something that I know NORD and the Ohio Rare Action Network is looking at that and possibly educating those stakeholders in there.
It's a really exciting time, and I think part of it is because we're testing the system in many ways by bringing in those new therapies and helping everybody in the healthcare system think about how to implement those new therapies that will benefit our patients. And so I see it is a challenge undoubtedly, but I see it as an exciting time as well for everybody involved.
Yes, yes. Well, thank you for your time, and thank you. After physical therapists, geneticists are one of my favorite people. So
thank you for saying that. And thank you for having me.
Okay, thank you. And I know you are busy. Thank you so much. Thank you. So
you're welcome.
Yeah. And Randy Kleitz, are you on the phone? Are you with us right now?
I am.
Well, Randy Kleitz, before she became the patient advocate there at the Little Hercules, she was really instrumental in getting House Bill 412 to establish the Rare Disease Advisory Council. We met at one of the Rare Disease Day events, and she just took the task and ran off with it. And she will talk about how it was important here as an organization, the Little Hercules Foundation, to have this Rare Disease Advisory Council. And again, thank you so much for championing this bill. We could not have done it without you, and I will turn it over to you.
Okay, thank you so much, Charlene. As Charlene said, I'm Randy Kleitz. I am a mother of a child with two. He's not a child anymore. He's 19 years old. He has two rare disorders. So I have been very active in Ohio around advocacy on rare disorders for most of his life. In 2005, I actually joined a few other parents in advocating for our state program called the Bureau for Children with Medical Handicaps, and the state budget was getting a cut. And after that advocacy efforts, I started getting more involved at the state level. So I became a parent volunteer for the Department of Health and started working on some stakeholder groups from Medicaid. And so one of the things that I decided to do was run for office. And so I did become a state representative for the 75th House District in 2018. And one of the things that I really felt very strongly about is needing the voices of parents and patients at the state level, working on administrative level policy early on. It seemed like we got called into the room once a decision was made to try and figure out how to fix an issue that they saw coming. And so I felt very strongly that we needed to be at the table when policy was being made. So I'd like to give a quick shout out to my legislative aide, Angie. If you were working with me as a state representative, you knew that Angie was behind the scenes. We took a lot of policy from around the country and made sure that we crafted the right legislation for the state of Ohio. And as Representative Ginter said, he worked very closely with me to make sure that the language was crafted in the best way that we knew that it would pass here in Ohio quickly. And then Stephanie Kunze, Senator Kunze was amazing. And it was really cool that you got to hear from both of them and their help in making sure that the bill passed. Without them, without your advocacy, we could have never got there. As Charlene said, when we were crafting the legislation, we wanted to make sure that there were a lot of different voices around the table to make sure that patients had the best outcomes in Ohio. And so one of the voices that I felt very strongly about was organizations at the table. I had served as the advocacy coordinator for the Ohio Bleeding Disorders Council for almost a decade before running for office. And having that in my background, I knew how important it was to have organizations, especially those that are small and cannot afford to have a policy director or somebody who is working or lobbying for them at the statewide level. So it was really important for me to make sure that we had all the organizations and foundations available to sit at the table on the RDAC. I'd like to make sure that you know, we want to make sure that the RDAC is full of different voices, that it's not just the larger disease groups in the state of Ohio that are active. So please make sure that if you're interested at all, I know they gave you some contact information for getting on the RDAC, but we would really love to have you RDAC. Sorry, all these acronyms are still a lot for me. So I just want to thank NORD and all the advocates who have kind of stood by. As Charlene said, a lot of you provided testimony throughout the process. But we need to make sure that we have organizations that are willing to also step up and serve the state in this capacity. The terms are 2-year terms, so if you don't get in for the first term, just kind of watch for the application process to start back up in 2 years, and we hope that we get a large variety of voices there. That's one of the goals, and Ohio's RDAC is a little bit bigger than some of the other states. For that reason, I wanted to make sure that we had lots of voices at the table. So again, thank you all so much for your advocacy efforts. I look forward to working with you in the future. And thanks for today's event too.
Thank you so much. Again, it was again a wonderful collaboration of other organizations, not just the Rare Action Network. So that being said, may I have the next slide there, please? Thank you. So I do have an activity for all of you. The RDAC is, once we don't have it established yet. The council is still being appointed. There's application process. I'll try to put the link in the chat session you know, in a little bit, or I'll show you where to find it, where you can fill out an application if you're interested. But what we have here is, I did a little brainstorming with other people on issues and concerns that RDAC should look at. And these are some of the ones that we would like RDAC to look at when it's established here. And at this point, I'm just going to go through each one real quick. And I want you to take time right now after I go through each one and just list your 3 concerns, your 3 issues or concerns that you would like RDAC to address. And you don't have to prioritize them at all. The first, of course, is so important, is access to care. You know, we really have, you know, some of us struggle to find the right care, to find the right physician. So access to care. The other one, of course, is drug cost issues as it relates to out-of-pocket costs. Some of those drugs that are out there are just, you know, mind-boggling on the price of that. Genetic testing, you know, access to genetic testing, like our geneticists talked about. When my daughter's first diagnosis, the genetic testing was over $3,000. It was like, whoa. So, of course, Medicare, Medicaid issues with that. Some of us have had issues with that. I know currently, and I'll have Tiffany chime in, I believe it's Senate Bill 17, where, yeah, Senate Bill 17 is putting some major clamping down on access to Medicaid. So that would be quite detrimental to the community. Newborn screening. Again, many of these rare diseases are diagnosed in the first couple years of life. And if you could have a genetic test done and you could do early intervention, how wonderful that would be. Medical food nutrition. There is a lot of medical food that is prescribed, but at the same time, the insurance company won't cover it. So that is an issue. Addressing the copay accumulator, that is one of the bills that we are going to reintroduce. And that is when pharmaceutical companies will provide financial assistance to your paying your copay, and the insurance company will not allow you to use that towards your deductible. So that I find is very discriminatory. I can't even say it. My mouth is drying up here. And data collection, you know, how many rare diseases are out there here in the state, and how many centers of rare diseases. You know, what does Cleveland Clinic cover? What does University of Cincinnati cover? What does OSU cover? What are the specialties in these states? And then finally, patient input in drug utilization or approval on preferred drug lists. That's another issue that we're looking at. So if you could just take a minute and put in your top 3, that's something that we can collect and just, present it to the council when it's together and say, here, this is a snapshot based on our Rare Disease Day event. And, we had these participants, and these are, the issues and concerns. And if you don't see one here that you would like us, to, bring to the table, please let us know. Please let us know. So at this time, just take this minute or two, and then we'll move on because we're almost done. here?
Hey, I don't know about everybody else, but the chat is showing disabled for me. So if you guys are waiting for us to drop stuff in chat, we can't.
Thank you.
It's back on. Thank you.
Yeah.
Yep, there it is.
And while you are doing that, I'm just going to move to the next screen. There, you can, there. So, of course, what can you do? First of all, most of you, when you registered, you had that option to join the Rare Action Network, and that is great. That is, you know, wonderful. You'll get emails from us and updates or call to actions, meaning we need your testimony or we need you to call your senator or representative to reach out on an issue or a concern. Follow us on Facebook. We have a Facebook page. And then you can also take action on the Rare Action Network page. And I'm going to just share my screen real quick. And share screen. Okay, and there we go. Let me continue. Can everybody, there we go. Can you see my screen now? Yep, there you go. So this is our website with the Rare Action Network. And under policy, there's also get involved. Under policy, we have various position statements that we have here. And this is at the federal level. We may have some issues on the state level, but these are what the statements that we have with through NORD on certain policies and issues. So that is something you can take a look at. And then also on these are the key issues that NORD is following at the federal level. So you can take action now by clicking on any of these issues. We like this, and we have a very simple form. It's already pre-formed, ready to go. Oh, well, I'm going to put in my address. And there you go. It's all ready to go, and you can personalize it and send it to your representative or your senator. I must say, Senator Brown is one of my favorite senators. He is a very wonderful advocate for Rare Disease Day, rare diseases itself, I should say. I worked with Senator Brown a couple months ago on passage of the medical surprise billing. So I don't know how many of you are familiar with that, where we, where we have, you get a bill from what you thought was from a doctor in network, and you have to pay for that bill because the doctor or the medical service was not in network. So happily that went through. So that is, we would love for you to volunteer. We're always looking for volunteers. Again, this is a wonderful event. At this point, we are going to go into our breakout sessions. If you have not signed up for one, we have had, we have 3 breakout sessions. The first one is newly diagnosed. The second one is living with multiple rare diseases. And then the third one is transitioning from childhood to adulthood. Again, I thank you so much for taking time in your day for joining us on this event. And I look forward to working with you in the future. Again, thank you so much.
Charlene, if you don't mind, could, oh, perfect. I'm going to share my screen real quick because we do have another slide that we want to share with everyone. Bear with me just one moment. Okay.
Oh, yes. Thank you. Oh.
Oops, sorry. Oh, my apologies. We'll get there. Okay. So I know here's the contact information for our wonderful Ohio team, if you guys would like to reach out. And then we are,
yeah.
Go ahead, Charlie, take it away.
Okay, yeah. We have door prizes and gift cards. The Connor B. Judge Foundation donated 3 swag boxes. These are our swag boxes. 2 of them are provided by NORD, and we have 3, and 3 additional from the Connor B. Judge Foundation, and they will be drawing those names at the end of the week, and we will email you if you had won. And this evening, Pam, if you can correct me if I get this wrong, but the Tower and the Terminal in Cleveland, plus the Rock and Roll Hall of Fame, will be lit today in honor for rare diseases. And then I got word that Nationwide Children's Hospital in Columbus will be doing the same. So now if we could get Cincinnati Children's, then we're all good to go. So, but again, thank you so much. And yes.
We have a special slide in here that Tiffany's going to present.
Oh, okay. Thank you, Tiffany.
Everyone, for those of you that don't know, Charlene is stepping down, and this is, I believe, her 7th Rare Disease Day that she's been a part of. So she has done a tremendous amount of work for NORD, especially here in Ohio. So we just want to thank her for everything that she's done. So sorry, we knew that you wouldn't let us do it if you knew about it.
Yeah. Well, you haven't gotten rid of me yet. You know, I'm moving to Columbus, so close to Columbus. So I'll be there on the floor for any testimony and all that. So you haven't gotten rid of me yet. Thank you. Thank you so much. So,
before we head to our breakout sessions, we're going to play one last short thank you video today, and then we'll regroup and get everyone transitioned into the breakout room that they would like to attend. So I'm going to play one last video here shortly.
Every year on the last day of February, the National Organization for Rare Disorders joins together with others around the world to raise awareness of the challenges faced by people living with rare diseases. Achieving health equity is even more difficult for rare patients. To have equity in health means everyone has an opportunity to be as healthy as possible, regardless of social, geographic, economic, or other obstacles that may be working against them. At NORD, we appreciate your support, which allows us to work on issues like health equity and many others, and for our staff and volunteers to bring them to the forefront on Rare Disease Day.
From the Volunteer State Ambassadors, we would like to say thank you to all of our Rare Action Network supporters for helping us connect with rare patients and families in our states.
And thank you for allowing the Rare Action Network to raise important issues with state lawmakers on Rare Disease Day and throughout the year.
Did you know that in medical school I was told when you hear hoofbeats, think horses, not zebras? What about the more than 25 million Americans living with a rare disease? At NORD, we are humbled to provide help and resources to our zebras and their caregivers.
NORD support allowed me to catch up on some overdue bills, including my rent. Thank you for your support, NORD, and thank you for supporting Rare Disease Day.
From all of us at NORD, thank you for your dedication to the rare disease community on Rare Disease Day and every day.
All right, so thank you everyone for sticking with us. We'll go ahead now and pop up the breakout sessions, and feel free to grab the session that you would like to join, and then we'll be regrouped with your small breakouts in just a minute.